Mr. Rutherford. Ms. Bustos?
Thanks. I want to thank the chairwoman for hosting this committee hearing, and also our ranking member. And thanks to both of you for your willingness to be here in front of us. Mr. Secretary, I love how you mentioned the Big Island and your focus on that. I'm going to take you to Rock Island, okay, along the Mississippi River. So that's the county where I live. And just to give you a little context about the congressional district that I serve, it's 14 counties, 7,000 square miles, goes up to the Wisconsin state line. Of course, the western border of the district is the Mississippi River, and we border Iowa. Of the 14 counties in my congressional district, 11 are almost entirely rural. And we have some unique needs in rural America. So this doesn't just apply to a district like mine, but in rural areas across our country. And what I hear when I visit any one of the 7 VA clinics that serve our congressional district is, first of all, I think most are very satisfied. I hear a lot of good reports from our veterans, very satisfied with their service. But transportation is an issue in a lot of our areas. How they get to 2 of the hospitals, VA hospitals that serve the congressional district that I represent, are outside the state. One is in Iowa City, one is in Madison, Wisconsin. The other one is, an hour away from a good part of the people who go there. So I'm just wondering if there's any way to address transportation needs in rural America. That would be like 1A, and then 1B would be any thoughts of partnering, for example, with mass transit districts, or just kind of what we could see ahead where I could give answers to these veterans who bring this up.
Well, in my original presentations, I talked about the leadership of VA and the nation not understanding the scale of the American West, but I would add that Illinois is the plain state and is just as every bit rural as Montana and Dakota. The reforms that we need to implement to make VA a modern 21st century healthcare administration include making access, as you pointed to, rural America a reality. One of the ways we're doing that is expanding telehealth. That also addresses the mental health issue that the chair has championed for so many years. Getting our veterans on the screen with doctors across the country, in their homes, which is vital in the doctors tell me for mental health, that is the key, and also addressing the transportation needs. But I think immediately getting them access to our VA medical centers through telehealth, and also coming to this committee and to your counterpart in the Senate and discussing ways that we can make it easier for medical health professionals to come to VA and spend their time in rural areas of our country. That, to me, is as great a concern as any, and I'll let Dr. Stone finish the answer.
So many of the VSOs support us in rural areas with the donation of vans and then run various transportation districts, and that's been a great partnership. And we'd be happy to discuss that in your area to see could we get it expanded into that. In addition, going back to the chairwoman's opening concept of holding up the sort of flow, in the Mission Act, there are 6 ways in which veterans qualify to go out. One of those, written into statute, is it in the best interest of the veteran? And in some of these areas, they are so remote that it is in the best interest of the veteran to not travel a great distance, even when transportation is provided. And that's one of the things that we really like about those sort of 6 criteria in the Mission Act, is that we can reach into that to do what's best for veterans.
And I would add, with Judge Carter sitting here, I've said in many of my speeches that the loneliest sign in America is on Interstate 10 in Houston, and it says El Paso 910 miles. Those distances are something that we have to overcome with modern technology. And I believe that Mission gives us the framework to do that.
Thank you. And Dr. Stone, I'll follow up with you separately on, we do have some clinics where the transportation literally is, we don't have a partnership with the VSOs who are providing that transportation in some of our clinics. So we'll follow up with you on that. And again, really appreciate both of your service to our
Thank you.
country.